Yeah, it's almost like for some people, these two concepts are interchangeable.
Well, I think this is a very important point for people to understand, is that people, for example, I am absolutely pro-vaccine. I would think that everybody who's high risk and over a certain age, whether that's 50 or 60, should get the vaccine. That's very different from forcing them to get the vaccine. That's very different from mandating with penalties or restrictions of freedoms unless they get the vaccine. That I am not for, and there's reasons for that. Number one, people that are, let alone, by the way, forcing everybody to get vaccines or not having freedom of employment or freedom of movement. The vaccine, the disease, again, is only high risk for some people, not for everybody. When you're vaccinated, you personally are protected from the deleterious, death and serious harms of the disease, no matter whether other people are vaccinated or not. And perhaps most importantly, we either live in a free society or we don't. It is true that certain vaccines are mandated for children. Those vaccines that are mandated for children, even if you believe they should be mandated, are for diseases that are highly dangerous to children and highly communicable to other children who therefore have high danger from that virus. That's not the case with this disease. Children do not have a high risk from this disease. Children do not necessarily benefit themselves from the vaccination of this. So that's a different type of thing. But in any event, the idea of forcing people to get vaccinated is particularly troubling because, A, we live in a free society, I think. B, we don't, this is a new vaccine. And what I mean by that is, again, it's a new technology. We don't have long-term safety data. C, we never did a large clinical trial on these vaccines because after the initial emergency use authorization, the control group, the placebo group, was injected with the real vaccine. So we got rid of the placebo group. And fourth, we see complications arising from the vaccines. It's not clear how many, but they're concerning. So we don't just rush ahead and force people to take a drug that is not completely understood, that we have no long-term history with, and that doesn't even necessarily benefit a large segment of the population because they are not at high risk from this illness. People, I would think, in a free society have the right to decide if they're going to inject a drug into themselves. In fact, the forced vaccines, particularly for children, violate several of the codes outlined in the Declaration of Helsinki from 1964 that is sort of a standard for medical ethics and morality. And I think, when you start having a society that violates some of the most basic codes of ethics, I think we're in trouble. And so we need to have the debate. There are some ethicists coming forward. They should have been in there from the beginning in the discussion about what was going on with the lockdowns. But we as a society have inflicted a tremendous amount of damage already, particularly on low income and poor people from the lockdowns. And that story will not completely unfold for many, many years. The massive harms, the missed medical care, the new child abuse, the tremendous psychological damage on teenagers, suicidal thoughts in 1 out of 4 in the United States, in college-age kids, a tripling of self-harm visits by teenagers to medical doctors, massive weight gain averaging 28 pounds in more than half of people 18 to 22 in the United States. We have created a massive healthcare crisis by the lockdowns. And those are mandates, those were demands, those were impositions on freedom. It's not just this theoretical freedom thing that we're talking about. We're talking about real harm. Now we're talking about vaccine passports. Okay, what if you have natural immunity and you're not one of these affluent people who's been sitting in their home with Zoom meetings and they're going to go get the vaccines? This is another example of discriminatory policy, harmful on minorities, as an example, since the lowest uptake, from my reading of the data, of vaccines is by African Americans, roughly, 50% less from, like, instead of 50%, maybe 35%. And they have their own reasons. It's an individual decision. There's a history of drug experimentation, and it's not irrational to say they're not going to take a vaccine mandated. So by that, you have minorities and lower income people who have been exposed because they were the essential workers. While the rich and the affluent sat in their homes, the essential workers were delivering their food, cooking working in the grocery stores, etc. Now we're going to force them to get a vaccine without excusing them for having the antibodies and protection, better protection, by the way, than the vaccines themselves. Somehow their movement is restricted all of a sudden. Only the vaccine is deemed worthy of freedom now. Only the vaccinated. So we have a lot of issues that are sort of unraveling here before our eyes on freedom. And, it's sort of trite to say it, but you don't miss the freedoms until they're gone. This is a very dangerous path we're going down. It's gratifying to see the lawsuits being filed by certain governors. I think we'll see more of that about these mandates and restrictions of freedom of movement. Like I say, you can have the option of getting vaccinated. You are protected if you get vaccinated. If you don't like that level of protection, you can stay in your house. You don't have to go on an airplane. You don't have to go to the store. You never have to leave your home again. You can wear an oxygen tank. You can do whatever you want. That does not mean other people have to do that. Not in what used to be a free country.
So there's this idea, and we've alluded to this a bit in what we've been talking about already, that people who are unvaccinated are somehow hurting society, are somehow hurting the responsible people who are vaccinated. And I want to get you to speak to that, because I think this is a more broadly held belief than I think even many people realize.
Sure, there's a couple things to say about that. I mean, first of all, we have to realize from the CDC data that something like 94% of people in the United States who are high risk have been vaccinated. 73% of people of all adults 18 and over in the United States have been vaccinated. And so there's some sort of a exaggeration or a misconception that there's this massive number of people who have not been vaccinated. That's number one. Number two, if you've been vaccinated, you are protected. If you've been vaccinated, you have very high protection against death and hospitalization. So what's happened, though, is that there's been this transformation of the concept of people who don't want government imposition or mandates or vaccine passports that restrict your freedom of movement or your job availability. They've been characterized as selfish. Freedom is not some sort of a selfish desire. Freedom is essential, and when you impose restrictions of freedom, you don't just get rid of the essential, concepts of life that we in the United States, that the whole country was founded on, but you actually hurt lower income people and poor people more. Because what happens is that they are the ones who, first of all, have a high rate of being infected and have natural immunity, but also they don't have the luxury of working from home. They don't have the luxury of doing their work on Zoom. It's an imposition of restrictions to protect the affluent class, the Zoom class. This is a massive sort of a social caste system that's being developed here. And so this is a false argument. It's just like the false argument that people who are questioning the lockdowns were dangerous, when instead we were asking for more protections of the high-risk people. We are in a country here that's founded on individual liberty. You have the liberty, the freedom to protect yourself. And that means you get the vaccine if you want, or you isolate yourself from large group events. If you don't want to drive on the highway because all the motor vehicle accident deaths occur at speeds over 60 miles per hour, then don't go on the highway. But you don't have to shut down the highway. And if you're afraid of certain settings, do what you can to protect yourself. You're welcome to wear 6 masks and stay at home. But the people who want to live in a free country, they have rights. And, it's just this, the selfish side are the people who are trying to tell other people what to do to protect them. That's selfish. What's not selfish is to allow people to live freely. Now, there's this movement that is really appalling that we've read about a little bit in various places, that people who aren't vaccinated somehow should not be given medical care or should not be allocated priority for treatment. I mean, this is totally immoral. I'm shocked if any doctor would say that, and I've read them saying it. This is really, again, like a massive descent of morality in this country and elsewhere, if you would even say that kind of thing. Because, that alone is just like saying people that are obese shouldn't be treated for the diseases due to obesity. People that smoke cigarettes, they shouldn't be receiving expensive surgery and chemotherapy for their lung cancer. And this is what we hear. We're hearing mutterings of this about people who have not been vaccinated. I mean, this is just unacceptable to anyone who wants to lead a moral or ethical life. This is just really despicable behavior, and we have to make sure as a society we prevent that sort of devolution of our entire nature. Individual liberty is critical to everything we have, and we'll never know what we've missed until it's gone.
So, Dr. Atlas, you've been, I guess, kind of pretty low-key to my eye since we, interviewed back in April. I understand you've been working on a book, so maybe, tell me a little about, why you've been staying low-key, what you've been doing with your time. Is there a book coming?
Sure. So the book, I have been working very hard on a book. It's called A Plague Upon Our House. The long subtitle is My Fight at the Trump White House to Prevent COVID from Destroying America, to Stop COVID from Destroying America. And you can buy it. It's available. It's finished. I was working very hard on it for months. And the sort of low-key visibility of myself was mainly that it took a lot of effort to write the book. The book was painful to write because it's shocking to relive and to remember the detail of what I saw in the task force. I think Americans need to know the truth about what was said, about what was not said. They need to know the truth about the level of scholarship, the level of critical thinking. It was shocking. And we can never let that happen again. That we have people who don't know what they're talking about, who are not critical thinkers, who don't know the data, be in charge. We can never let that happen again. We can never excuse that, and people need to know exactly what happened. So that's one of the 3 things that I talk about in detail in the book. I also talk about the facts of the data. I go through in a hopefully readable way the data on some of the key issues, on who's at risk, on kids, on natural immunity, some of the issues that were very contentious about testing, when it's appropriate, when it's beneficial. And these things I think people need to understand. On masks, I go through quite detailed discussion on. And then the third part of the book really the goal of the book is to talk about what happened, the big issues, the censorship, the really unacceptable behavior in the university environment of people who are afraid to admit they're wrong, and instead of debating the data, they want to destroy people who are saying something other than what they believe, the politicization on campus, the cowardly failure of leaders of universities to step up and ensure that our children, our nation's most precious resource really, are going to these universities and being able to see a free flow of information that we have promised them as a society, to turn them into critical thinkers rather than just somehow compliant believers in a narrative. And by the way, people are paying over $250,000 for the privilege of attending those universities. You have to wonder what they're getting for their money. So I think, the media, the bias of the media, we're in a society, in a country where, they pulled down the YouTube video of myself and 3 other medical science experts having a press conference with Governor Ron DeSantis in Florida. Somehow we're pulling down, the YouTube pulls down the video of that. I think that Americans need to know what's going on. So I think the book, it's shocking. I relate in quite detailed discussion what was said with quotes about people from people's mouths in that room. And I think I can assure people of 2 things. One is everything I say, every word I say in that book is true. And anybody who knows me knows that, I'm a very direct speaker, and I don't care about anything except saying the truth. The truth matters. And the second part is that I can guarantee that the people who I quote in that book will deny they said it. Because their whole careers are based upon these perpetual bureaucratic jobs. They've been very successful at navigating the political environments in various government administrations. They're politicians. They don't think like scientists. They don't act like scientists. And I'm exposing them for what they really said and did, including the really heinous ignoring of the impacts of the policies, the lockdown policies that they pushed and imposed on people to people's destruction and death. And so, we have to know the truth. The American people have to understand what they were listening to here because we can't afford to have that ever happen again. And there will be other crises that we need to deal with.
Okay, wait, so let me get this straight. I didn't realize this. You're saying the book is available now?
It's only available to pre-order now. But yes, it's available to buy from all the variety of ways we buy books. And, it'll be out sometime in mid to 3rd week of November.